Hello there. Pleasure to meet you. I'm Nurse Cece, and I'm going to be performing a nurse exam while you're in bed. Is that correct? Great. Pleasure to meet you. Yes. Just sit back and relax in the medical bed, and I'll just perform the exams, okay? Are you okay with me being your CNA today? Okay, let me know if that changes at any point. What I'm going to be doing today is just checking you head to toe before the doctor comes on in and checks you afterwards, okay? Fabulous. So, I'm going to open up my notebook here first. And on my chart, it just says that you've been a bit under the weather, a little bit sick, and that perhaps your sleep hasn't been too good. Would you say that's correct? Okay, a couple of personal questions before we begin with the physical exam. Could I get your first name and the spelling? Okay. Do you spell that with an I, an E, or a Y? That's a beautiful name. And last name, please. Gorgeous last name. And may I get your birthday and the year? And I do have to ask this, it may be a silly question. Do you know where you are right now? Good, you're at Dream City Medical Center. Do you know what day it is, what the year is? Great, thank you. I always have to ask that before I begin. So, what we're going to do is perform a basic medical head-to-toe exam while you lay there in the medical bed. I'm going to first just clean my hands with some sanitizer, and I'll get gloves on as soon as we start touching around the face, okay? So, how are you feeling? Okay, I'm going to get just a quick vital from you first. May I get your temperature? You're just going to see a flash. Just sit still, and it's going to swipe across your forehead. 3, 2, 1. Okay, it looks like that was a bit warmer than usual. I'm going to take one more. You're going to see a light flash. Okay, and that temperature is a bit warmer than usual. Are you feeling a little bit cold? I can always get you another pillow or a blanket. Okay, let me write that down. Temperature a bit more warm. Did you come in feeling a bit sick today? That's okay, if you can let me know. Okay, and next what I'm going to ask you to do is just sit still. I'm just going to check around your scalp to see if you have any abrasions or scratches, etc. Is that okay with you? Good. I'm just going to carefully just check around the scalp. Do you know if recently you have been having just a bit more tiredness than usual? Okay. Just tell me anything you want to let me know, okay? Just giving you a quick braid to move that out of the way. Okay, looks like your scalp is clear. I'm gonna get some gloves on now. And we're gonna start off with just touching around your face. Okay. Is that medical bed cozy? Go ahead. If you need me to adjust it at all, let me know, okay? Now, do you have any allergies? There are many allergies. You can have allergies to peanuts, which is very common. Do you have any allergies to coconut? Do you have any allergies whatsoever, even gluten? Okay, I'll make sure to write that down in your journal. And I'm just going to touch just roughly around your face, okay, and around your eyes. Just sit still. Okay, could you look at my nose? Okay, can you look at that little picture on the wall? And can you look at this Snellen's chart right here? Have you had any problems with your vision lately? Okay, do you wear glasses or contacts typically? Okay, and then a quick question. May I shine a light in your eye? If it's too bright, let me know and I'll move it away. I'm going to be checking to see if your pupils are dilating and contracting properly, okay? I'm just going to put one hand here. If I could ask you, could you please look at my nose? I'm going to get really up close here. Just look at my nose. Good. Great. Pupils are working as they should. They are dilating and contracting well. Good. Okay. Look at the light for me right there. Okay, and moving the light away. Can you look at the light again? Good, and moving the light away. And once more, can you look at the light again? Good, and moving the light away. Now I'm going to ask you, do you feel any sense of dizziness since I put the light next to your eyes? Okay, let me know if that changes at all. I'm going to do the other eyes now, okay, darling? Okay, can you look just right at my nose while I do this? Good, just look at my nose. I'm checking to see if your pupils are working well. Good. Just checking to see if the pupils are working well. Looks like they are. Okay, same as before. Could you look at the light for me? Good, and moving the light away. Great. Look at the light for me. Good, moving the light away. And can you look at the light for me? And moving the light away. Good. And I'm going to ask you again. Are you feeling any type of dizziness since I put the light next to your eyes? Okay, let me know if that changes at all, okay? So, I'm going to actually use another tool now to take a look at the side of your eyes, look at your cornea. And what I'm going to ask you to do is follow the light to the best of your ability. And I'm going to even give you a red light analysis to see if your corneas are looking good. Okay? So, I'm going to get up real close, okay? And there's going to be a little light that's right there at the end of this tool. I'm looking carefully in your eyes, okay? So just follow that light. Good, follow the light. Good, follow the light. Good, look at the light. Great, follow it. And follow. Good. Follow the light. Good, follow it in this direction. Good, and look back at the center. I'm shuffling to see that there is everything going right with your eyes. Good. Okay, a little closer now. Just look at the light. Good, and follow it. Good, and follow it the other direction. Good. Great. Okay. Good job. It looks like your eyes are doing well. You happen to have very beautiful brown eyes. They're slightly blue as well. And you even have a touch of green. Gorgeous. So, writing that down, I'm now going to touch around your face, okay? And you let me know if you feel any pain whatsoever, okay? And I know that you're sick, so let me know if that changes at all. Any pain, yes or no? Okay, yes or no? Yes or no? Yes or no? What about here? Here. Yes or no? Yes or no? Yes or no? Yes or no? Very good. Very good. Okay. Now, I'm just going to take a look at your vitals carefully. We're first going to get your heart rate, okay? And I'm going to use the stethoscope. And I'm going to place it here on the chest and here. And then we're going to listen to your lungs and your stomach, okay? Good. All I want you to do is listen to what I say, okay? And just keep relaxing in the medical bed. Let's place that right here. Okay, there. Okay. And what I want you to do is just breathe in and breathe out. Good. And let's listen carefully. Good. Other side. Right there. Okay. And breathe in and breathe out. Good. I'm going to place it on the abdomen now. We're just going to listen for bowel sounds. I know that sounds silly, just to make sure that everything's going well with you, okay? So, let's put that right here. Great, that sounds perfect. Now, I'm going to listen to your lungs. Is that okay if I just reach around and place this at the lower part of your shoulders? Okay. I'm going to just reach right over here. And what I want you to do is just breathe in and breathe out for me, okay? So first, breathe in. And breathe out. Good. Through here. Breathe in. Breathe out. Perfect. Over here. Breathe in. And breathe out. And once more. Breathe in. And breathe out. Good. Okay. So, I am listening to everything carefully. So far, it looks like your vitals are doing okay. You just sound a little bit sick. That's okay though. Okay. I'm gonna continue now checking your sinuses and your nose and your mouth, okay? So, if I could ask you to just carefully, can you look at the light? I'm just gonna check your nose. Good in there. And is your nose a little bit clogged currently? That's okay. Good. What I'm going to ask you to do now is, can you just say ah for me? Say ah. Very good. Are your teeth bothering you at all? Okay, any problems with a sore throat? Okay. Just looking one more time. Say ah. Good, that looks perfect. Okay, and relax with that. I'm going to check inside your ears now with this little tool. You're just going to hear me rummaging around. I'm just going to look if there's any ear infection or any sign of that, okay? Good. So, I'm just going to shine this right through there and take a look with my eye, okay? It looks like just a little irritation for the ear. No sign of infection though, which is great news. Okay. And that looks good. Do you happen to wear any hearing aids or any tool that helps you listen to things? And do you wear headphones? Okay. Now, do you limit the amount of loudness or volume you hear if you listen to music or the radio? Okay. We highly suggest that you lower the volume, and we also suggest that you try not to sleep with headphones in your ears because that could cause ear infection, okay? Good. And we're going to move on to the other ear now. Please pardon the airplane. Okay, I'm going to take a look right there. Just looking right inside the ear, okay? Okay, this ear is a little bit more irritated. But it looks fine. And can you hear the tool in your ear? Good. Okay, so your ears are doing super well. And it looks like that's perfect news. Okay, let's continue now. I'm gonna just carefully adjust your ears and put my hands around it. Can you hear this? Good. Can you feel this? I'm going to cup your ears now. Will you let me know if you can feel that? Good. Just going to put my hands right there. And does that sound a little bit different? Good. Okay, that is exactly what we're going for. Good. So, it looks like your ears are working well. Okay. Next, I'm just going to put my hands here and move to the shoulders. Let me know if you can feel this okay. Okay. And now your lymph nodes, can you feel that? Does it hurt at all when I put some pressure next to the lymph nodes? No? Good. And then can you just swallow for me like usual? Good. Now just around the side of the neck. Okay. And the shoulders. Fabulous. Now, I'm going to carefully just test your musculature, okay? I'm going to tap on certain parts of your face and you're going to react naturally. Don't worry about reacting, we're just going to tell right from this. Okay, good. So let's see right here. Good, under the eye. Here. Chin. Good reaction. Okay. Shoulders, chest. Shoulder. Can you give me an arm? Good. Elbow. Hand. Good. And can you wiggle your fingers for me? Good. Other arm, please. Shoulder. Elbow. Hand. And can you wiggle your fingers for me? Good. Okay. Now that you're laying down, can you just bend the knee a little bit? And if you can, try not to kick me. I'm going to test your reflexes on your knees, okay? Good. Bend the knee. Once more. Good reaction. Bend the other knee. Good. Perfect. Okay, then we're going to test your ankles, okay? Good. Super. That's perfect. Okay. And do you have any pain for me testing there at all? Okay, just let me know at any point if you do, okay? Okay. And I'm just going to quickly test your cranial nerves because you are sick. I'm going to pull out 3 essential oils here. And all you have to do is tell me what you think they are, or close to it. They don't have to be accurate, okay? But I pulled out 3. Close your eyes and tell me what you think they could be, okay? They are very basic and common essential oils and smells. They're not too difficult, okay? So, close your eyes and don't take a peek. Let's see if your cranial nerves are working well, okay? So, keeping your eyes closed, what does this essential oil smell like? Okay, you're smelling floral, tea, herbal. Any guess? Okay, good. That is floral. Good. This one's actually lavender. Great. And the next one. Keep your eyes closed, okay. And what is this next one? Right under your nose. Don't take a peek. That one smells like citrus, like oranges. You got that one immediately. Very good. This one was orange. On to the last one now. Okay, keep your eyes closed, okay. And what's this last one? Breathe in and breathe out. Okay. And what is that one? That one's refreshing, opens the sinuses, and it's minty. Very good. You got it. That last one was actually peppermint. And all those answers were acceptable. Good job. Great. Now, I'm just going to carefully take a look right at your eyes. Looks like your eyes are fine. Looking right at the nose. Okay, the mouth. Good. Ears. Shoulders. Arms. And legs. Okay, good. It looks like your head to toe exam is complete. I am going to be sending your results in to the doctor, and they'll perform a full exam afterwards. And there are going to be the ones that will prescribe you medicine to help you feel better, okay? Good. Again, I have been Nurse Cece. I am checking you off on our good list for this nurse head to toe exam, okay? And the doctor will be in shortly. If you need me whatsoever, all you have to do is hit the button that's at the side of the bed. And we can also go over your exam results by morning time. Is that okay with you? Great. So, the doctor will be in shortly. I'm just going to close out here, and I want you to relax before the doctor sees you, okay? Great. Thank you so much for coming on by to Dream City Clinic. And I will see you after the doctor sees you again to talk about your results, okay? Good. Have a good one now. Bye-bye.